Just want to welcome everyone to the Cigna HealthSpring presentation that we have today. We really appreciate you taking the time to join us. What better thing to do on a snowy day here in Northeast Ohio, right? So,
For sure. All right,
yep.
Jamie, I'll start moving these things along. And just a quick welcome to both Jamie LeBron and Colleen Baird for co-hosting us with Cigna today. All right, Jamie, you're up.
All righty, great. So before we get started, just a couple quick housekeeping items. So please mute your phone so that we don't have any background noise. And if you have any questions, we ask if you can type them in the chat box, and we'll try to address them as we go, or if not, we'll definitely address them at the very end of the presentation. And we'll also have extra time, so maybe we can even take some live questions if need be. This presentation is being recorded, so don't feel if you miss anything, you can always come back and view it later on our website. And basically, with our www.cornerstone senior marketing website, we have information that's available for you 24/7. You can view the webinar recordings. And also we have information regarding our Medicare Center, which is our online enrollment tool platform, which we are very proud of. It's really been growing very steadily over the last couple of years. And with the Medicare Center, we've had some upgrades and updates that's been added to it. So right now, currently, you can upload a client list to the Medicare Center by using our CRM, which is a client relationship management tool that is built into the program. So there's no additional cost for this, but it's a way for you to track your clients and put notes and follow-up dates and information in there that you can have at your disposal. We also have expanded print capabilities in Medicare app. Previously, you weren't able to print everything that you wanted as far as what you were looking at on the screen. So that's been upgraded. So at the very top, there's a small print icon that you can click on, and that will allow you to print your information that you're looking for. Also, with the CSG Market Edge, you can analyze multiple trends based on geographic location, and this is really in particular for Medicare supplement products. So with Medicare supplement products, if you want to look at what the competition is doing, try to get an idea of comparisons in a particular market or zip code with other carriers that offer Medicare supplements, it will actually allow you to analyze that much data so you can get some precise information as you're shopping and comparing rate quotes for clients. So, and another thing about CSG that we're excited about is that they are also an integrity partner. So they are part of the Integrity family, which is really great. We have a lot of internal connections now that can do better to assist you as the broker. Also on our website, you can view our agent toolkit. With our agent toolkit, you have access to view information regarding our online services discount program. We have a vendor called Snoozy that we work with. They've been doing a very good job in helping our brokers get themselves some exposure regarding social media. So whether that's LinkedIn or Facebook or Twitter, they can assist with creating some type of a campaign to help get more exposure regarding your services and your background or your agency. Along with that, if you have a website, an existing website, or if you don't have a website at all and want to create one, they can assist either way. They can help with enhancing your current website and then also help to create a website for a very minimal charge. And it's really a unique opportunity that we have available for our brokers that quite a few of them have been taken advantage of, and they can develop campaigns based around what you'd like to see happen. And there's no cost to have a consultation. Marilyn can also assist with the conversation when it comes to working with Snoozy. And then also included is in our Broker Centric, which is our marketing repository platform. We have a number of different marketing pieces that are available for you, very generic. But they're all customizable, so you can include your name, your phone number, contact information, photo or logo, what have you. Again, Meryl can assist with actually creating a piece that you'd like to see have in place. And we have a library that you can look at, and you can literally just pick from a number of different items. We have a robust library. Also included, we have information regarding compliance. So if you're not sure about what you can do or what you cannot do, we do have a compliance workbook in there that you can download and save, and you can reference at your leisure. And then again, we have a webinar library. So just like today's webinar, that's where we house all of our recordings, so you can come back and look at it at a later time.
Thanks, Jamie.
So with that, we want to welcome Angelo Rosato, who's the Ohio sales leader for Cigna HealthSpring, and he's going to update us with updates with Cigna and share information with us. And once again, if you have any questions, please type them in the chat box, and we'll be more than happy to address it for you. Also, I just want to recognize that we have Colleen Baird, who's our Northwest sales director, that's also on the call with us. So if there's any questions pertaining to that particular area, she can also assist. So with that, I'm going to go ahead and we'll turn it over to Angelo.
Good afternoon. Is it possible I can get a share screen?
Yeah, I'm going to stop sharing my screen now, and you should be able to go ahead and share your screen, Angela.
I just lost you. Hold on a minute. Give me a moment, please. I'm not as familiar with this program, so my apologies. Okay. Can you see me?
Not yet, Angelo.
How do I open this? I mean, unfortunately, I'm not very familiar with it. Somehow it closed on me.
So you want to click on share screen.
I can't see that part of it, is what I'm saying. I can't.
Yeah, if you see the, if you can see, it's just it's a small toolbar.
All I can see is your name. There we go. I think I'm here now. All right. I found it. Sorry.
That's okay.
Can you see my screen now?
You sure can. It looks great. Thanks, Angela.
Okay. You're welcome. Thank you. So what I'm going to do, I'm just going to go do a little overview on Cigna and the Ohio market for 2021. And then I'm going to go over some additional things, online tools and so on and so forth. So without further ado, this is who I am. My name is Angelo Rosato. I actually been in the industry. This is my 27th year. I do like baseball and boating, and just to give you a little insight about me, but I all around kind of person, really. I'm going to go over who we are, a little bit of history about Cigna, our approach to the market, some of the resources and tools available to you, and an overview. So one of the things that we did differently because of COVID is most of the companies have a meals program. Well, what we did because of COVID is we actually doubled our meals availability for consumers, just because access is a lot more difficult now. People don't go out as much and so on and so forth. There's just some of the things that we did a little bit different. We also have 360 exam card, the gift card program, and we extended those dates as well because of COVID until all of these restrictions are lifted. A little bit about Cigna. Now, we've been around for a long time as an insurance company. Cigna actually started insuring a lot of the merchant ships over 200 years ago, traveling from here abroad throughout the world. So the company has really strong, long roots. 100 years ago, actually started doing health insurance indemnity plans. A little over 25 years, we actually started offering our Medicare Advantage and our Med-Sup plans. And in 2006, we also participated with all the other carriers to include a Part D plan. We acquired the HealthSpring side 8 years ago. And in 2018, we actually acquired Express Scripts. So that is our Part D carrier. Cigna's mission, one of the reasons why I'm here actually, is their mission statement really reflects how I feel. We're here to improve the health, well-being, and peace of mind of those people that we serve. We believe Medicare beneficiaries should live strong, healthy, happy lives and be able to enjoy the people that they love. I believe in doing the right thing always. As a Cigna representative, I think that it's important that if we talk to our brokers and we want them representing us out there in the community, we want to make sure that if you're going to enroll somebody in our plan, that it's the right fit for them. I mean, we don't want to force a square peg in a round hole. It's important for us to make sure that when you put a customer on our plan, that we're going to be able to provide them the best service and we're a good fit for them. We're really here and ready to strive to every challenge, even some things that may be uncomfortable. We started in this market, we only had the Cleveland Clinic. I knew that was going to be an uphill battle only because we have 3 or 4 different hospital networks in this area. So I know that as we go along, we're continuing to build our network. So it's important for us. So when I engage with the brokers and the agency leaders, I'd like to hear their feedback. I want to know, what are we doing? What are we doing right? What are we doing wrong? How can we enhance what we have in the community? How can we better serve them? So it's important for us to listen and learn what's being said out there so that we can grow as part of that. So some of the values that we bring to the area. So we want to make sure we do incentivize the providers to make sure that they're doing the right thing for their patients. So we're not incentivizing them to keep them out of the hospital. We're incentivizing them to keep them healthy. So as we all know, the STARS program is something that is used by Medicare to rate the quality of the different Medicare plans that are out here. So it's important for us to make sure that we're keeping these people healthy. So the nice thing about that, it all comes back to the brokers. They can feel confident about selling a plan that they know we care about the customer. We're out here trying to improve the quality of their health. We're trying to make it easier for them to engage with their customers. And we're offering a program that has a good star rating. So nationally, we average 4 stars, but we also have a couple plans in Florida that are 5-star plans. So our focus is to, and we strive to make sure that we can get as high as we can and near perfect. What's nice about that for our customers, since we offer more than just one product, part of the reason is we want to give them access to care locally. We want to be there if they need any care coordination or anything like that. We do offer different services for that. So it's important that we're there for our customer and we provide the highest quality for them. So some of the tools that we have available. We have our care transition team. Their job is to make sure that that customer is getting all the services that they need. They're attending the hospitals when they need to be at a hospital for surgery, making sure they're doing their follow-ups and so on and so forth. So it's really critical for us to make sure that our care transition team is taking care of our customers well. 360 Wellness Exams is where we offer gift cards and incentivize people just for getting their physical examinations. So if we're doing the right thing and taking care of themselves, we're offering different types of incentives for them as well. So that's offered on our PPO and our HMO plans. We also have care programs, and the care programs really kind of coordinate with the care transition team. They kind of work hand in hand to make sure that all the customers are getting all the services that they need. A little insight, I mean, we have over 85% of our MA customers are in value-based arrangements. So that would be something like a Dedicated or an Oak Street or some type of health system that really is focused on providing the highest quality care at the best value. Our customer satisfaction rating is over 70 across all of our markets. And our clinical care, and I kind of mentioned this earlier, 87% of customers will be in a 4-star plan or higher in 2021. So we really are emphasizing providing quality care for our customers. So here's some of the things that we have available to you. So we have local market knowledge and support. So myself, I've been in this market for over 26 years. So I know this, I know the market, I understand the hospital systems, I understand how to market and sell the products. So I can help a broker come in here and develop a marketing plan or a business plan, if you will. I can help provide co-op opportunities for them. So it's important that they understand so they can actually go out and talk about our value proposition, our products, and how it really is in the right place to be able to help their customers. We also provide sales and compliance training along with what Jamie does. I'm also here to support you. Issue resolution and escalation. One of the things that I think is important with that is I'm not here to sell for the broker. I'm here to support the broker. I may have a lot of experience, but my job is to make them better. And that's what I'm focused on. So I can provide them with sales material, giveaways, any marketing support that they need or sales support, I'm available to them. Just some of the preventative care. These are some of the things that if they do, they get incentives for. So here's some of the resources and tools that we have for the brokers. Our call, so our broker access line, it's one of the, in my opinion, it's one of the better ones. And over all the years that I've been doing this, like they can actually enroll someone with your broker online. If you have a customer that may not want someone there because of COVID, or they don't have access to a computer, but they still want to be able to enroll them over the phone. So what this does for your broker, it gives them the opportunity to do all of it over the phone, connected to our agent resource line, which is really nice. It's just a convenient feature that we offer. Our Cigna for Brokers is really a contact management system. And through the Cigna for Brokers, it's a Salesforce platform. Not only can I give leads to the brokers and have them have the ability to track their leads and go forward, they can also track their book of business on our Cigna for Brokers platform. And I'm going to talk a little bit about that a little bit later. We do have a Pearl, so a personalized URL is available for them. Custom Point is something that just about every company uses right now as far as for getting literature and so on and so forth. And Producer University is where they go to for training. They can go to for training, for resources, and it's just a lot of things you can do on Producer University. So here's some of the things that Carl can do. So let me, break it down a little bit. They can help look up formulary drugs, help look up providers, plan information, LIS verification, training portal support. So if they're having issues logging on to a particular tool that we have, online tool, they can verify application status, and they can also ask about licensing and appointment information. Also help with customer resolution issues, selling advice, and onboarding. So here's our Cigna for Brokers platform. I advise everyone that sells Cigna to have access to this, because this is a way they can actually look at their book of business and really just good contact management system. They can track everything that they're doing with their customer, and it's just a really good system to use. And I do provide training for that. This is our DRX system, and DRX system is to be able to send, your URL is set up through this particular system. So the URL, you can actually email someone your link and they can enroll without you actually having direct conversation with them at the moment. And then once they enroll, you can actually call them and kind of talk to them a little bit, make sure that they understood what they were doing. Or if it's just a spouse of one of your current clients and they already know the plan, you send them that URL. If they have the capabilities and the knowledge to be able to do online enrollment, they can enroll themselves and it's still your customer. So it's just a nice convenient platform to use. This is the e-enrollment, and this is another thing that I really highly recommend your brokers to do. And this will give you an opportunity to send scopes through text or email and do online enrollments. And this is a really easy one to use, very easy one. And I can provide training, and I do provide training on that as well. And the training on this probably takes 10-15 minutes. It's really that simple. We do offer Telescope, So not only do we do the online, the enrollment through our call system, but you can actually use this number and get a scope of appointment done over the phone. So you'd set up a three-way call and they would acknowledge whatever you're going to talk about. It's just another convenient way for you to access a customer or a potential customer when you can't see them face to face, if you're just doing it over the phone. So this is kind of a little bit of information on the electronic scope and how it works. And I'll cover a little bit more of that on a kind of when we do actual formal training on that. This is our provider search tool. One of the things I will tell you about that, it's really important to make sure you got the county right. So I've noticed if you just get the state, you could click the wrong county and you won't show any providers. So I can also do a specific training on that as well. So, all right. So we're in Ohio. It's a new market for us. We started AEP. We are here with the Cleveland Clinic, and we just signed Southwest General Hospital. We just signed a contract with Metro Health Hospital. So those things should be loaded. Southwest is already loaded. Metro Health is already starting to load in. The hospital itself is not showing up on our doc find yet because they just signed the contract last week. But that's something that's going to be in our system and available for next AEP. It should be available actually within a couple of months. We're also currently contracting or working on our contract with university. So that should be, fingers crossed, should be done and ready to go also for next AEP. I think everyone's pretty familiar with how HMO plans and how PPO plans work. So this is our current market. So right now we're in Lorain, Medina, Cuyahoga Summit, Lake, and Geauga. We offer two products in those areas, our HMO product and our PPO product. So here's our HMO product. It's a zero premium HMO, and this is just a highlight overview. Zero copayment for PCP, $25 for specialist. Lab services are zero. Our OTC is $100 per quarter, and we do offer name brand products in our OTC catalog. Also, the $100 carries over all the way through the end of the year. It does not go from one year to the other, but it does carry over from quarter to quarter within a calendar year. So that's a nice feature of that. Another thing that's not listed on here is that we have a $2,000 dental policy on our HMO plan. On our PPO plan, it's also zero premium. One of the nice features on our PPO plan is out of network, there is no deductible. So for primary care is zero, whether it's in or out of network. For specialists, it's $30, whether they're in or out of network providers. Hospitalization, same copayment, in or out of network. So those three main services cost the same whether you go to a hospital that we have in network or out of network. What I like about this product, and I think a lot of the brokers like, is if they're traveling abroad, even if they go to a place that there is not a Cigna plan, they can still use that out of network benefit, and it's very valuable. And with this particular plan, you do have a $1,000 dental, and they can use any provider for that. And it's not a reimbursement, it's an actual allowance. Our preferred pharmacies are, I'm going to say locally, so Walmart, Rite Aid, Walgreens, those are kind of, and Giant Eagle, those are the local ones in this particular area. I mean, we do have Kroger's and some of the others, but I know that we don't have a Kroger's in Northeast Ohio yet. Okay, so I mentioned already the over-the-counter, and I already told you that it carries over through the end of the year. And the catalog actually looks like a magazine. I think, Jamie, have you had a chance? I think Jamie's had a chance to see that.
Yep.
Okay.
Angela, can you I'm sorry, just to jump in real quick. Who's the vendor for the over-the-counter? Who's your preferred vendor for that? Can you share that?
It's just us. It's our magazine. We use a private pharmacy for that. So it's not an outside. Remember, we have Express Scripts, so a lot of our stuff is in-house. That particular one is in-house. And I'll make sure I give that to everyone. So do you not have a catalog?
I probably do. I just have to dig it up again. Sorry.
Okay, all right. So I mean, I'll make sure that I provide a catalog to you so that you have it. So that you have that available. We use all, I mean, name brand and generic is available on the catalog. Post-meal benefits. So I mentioned earlier that we expanded ours through the COVID. So instead of just the 14 after hospitalization, we do 28 until the COVID restrictions are lifted. And that's through GA Foods. We do transportation, and we use services like Lyft and so on for that. We have 50 one-way trips on the HMO plan. Our hearing aid benefit offers a nice feature as well. It's $700 per ear. However, we cover the batteries for up to 4 years at no cost to the member. That's one of the nice features on our hearing aids. Silver and Fit is also available. We do not use silver sneakers. And we are, if there's any gyms or things like that that are not in network, I always encourage the brokers to either send me a particular facility that they want added, and I'll send it out to Silver and Fit, or they can go on their website directly and just recommend one. And I mentioned the dental services already, but it's $2,000 for the HMO plan. We use DentaQuest, and it's coverage $1. So there's no having to pay anything for your basic visit. It's all covered from $1, up to $2,000. And we cover everything but implants. And the dental allowance, which is for the PPO plan, there is no network, so they can use any provider, and they get $1,000. The telehealth services that are available. And we also have telehealth for therapy services. So people that are doing physical therapy that can't go to the offices, if they have access to a tablet or a computer, they can actually do them at home. Behavioral health, there's no cost for that. And that's something that we've had even before COVID. So it's a zero copayment for mental health specialists. So here's our producer university. So here's where I'm going to kind of go off a little bit, and I'm going to change the screen. But this is where you're going to have access to the different trainings to be able to, like the Cigna for Brokers, to be able to access your book of business, Jamie, that we talked about. So let me go out here for a second, and I'll show you what I have. Okay, so this is the Cigna for Brokers right here that you log on. And when you come on here, you go to My Learning, and you scroll down in My Learning. And right here, it shows you all the trainings that are available. And they're really short trainings. They're 20-minute trainings. But this will actually show you how to do lead management, how to set up an event if you're doing a marketing event, how to keep track of your enrollment, application status. All of these things are available for you. So the general functionality is where you would go if you want to look at your book of business. And this is the particular training that is available to them. I'll just kind of go through it real quick just to kind of show you. But this particular training, you see, it's not a long training, but when you go through this, by the time you're done with this particular training, you'll be able to keep track of your book of business and all of that. Because I know, Jamie, we talked about that earlier. So I wanted to make sure that you know that there is something specifically available for that. And it has to be done on an individual basis because not everyone wants the same type of access. But everything is available through your producer university. Okay, let me go back. All right. Sorry. And I think that was it. That was it.
Okay, great, Angelo. We do have a question in the chat box. If you have any questions, just a quick reminder, please go ahead and type them in the chat box and we'll be more than happy to address them. So Angelo, we have a question from David. And
yeah, let me take the screen off.
Okay.
Hold on.
There you go.
All right.
Perfect. So David is asking if you can please define value-based arrangements, if you can give a little bit more detail about that term.
Yeah, it's like like dedicated and Oak Street or value-based systems where they get incentivized to make sure that the member is receiving the highest quality care. In other words, the healthier they keep that person, the more they receive. I mean, those agencies are like that. So they get capitated, and it's not. We're not the only ones that do that, but Oak Street and Dedicated, they get capitated to take care of that particular member. So when somebody joins, they'll get X amount of money. I don't know the exact amount to take care of that particular patient. So if they can keep that person healthy, obviously they make more money. So, that's more of the value based. So we incentivize the providers to make sure that they're getting the best quality care. So if they're being kept healthy, that to me is more value based because you're not paying a high amount to do 20 tests. You're actually doing what is necessary to keep that person healthy and happy. Hope that answered that.
Great. Yeah, I believe so. And so just so everyone is aware, for those here in Northeast Ohio, I'm Dedicated and, excuse me, the Dedicated accepts Cigna. I don't think you have Oak Street yet.
Yeah, we do.
Okay.
We have
So,
both.
all right. So
We
both
have
of them do accept Cigna. So, and Dedicated is new. So you guys just recently completed a contract about 3 weeks ago or so. So, so just so everyone's aware that members can access Dedicated, they can have Dedicated and Oak Street Health providers as their primary care physicians. Any other questions?
Oh, did I mention co-op?
No, go ahead. You can elaborate a little bit more.
Okay, so we want to get involved with the brokers and help you guys fund some different marketing events out in the community. So we're definitely open to providing some co-op dollars for you. If you have some good ideas that are good opportunities to grow some membership, I'd like you to reach out to Jamie, and then Jamie reach out to me, or you can reach out to me directly, and I can kind of sit with you and we can go over what your proposal is, and I can, if it's a good proposal, we're going to help you fund it. So I want to be able to provide that support for you guys.
And Angelo, you also have marketing Cigna branded marketing pieces that the broker can have their information placed.
Absolutely, through Custom Point, we can tailor a particular flyer or marketing piece that will have all your information on it. So I think it's important to know that you have that available to you. And I also, I can provide you some giveaways. So if you have like a health fair or something like that, and you need some giveaways, tablecloth, what have you, we have to register it, through CMS per their guidelines. But I definitely can supply you with pull-up banners, with tablecloths, giveaways, things like that. So, yep.
Angela, is there any additional training required if somebody wanted to do a seminar, let's just say a sales seminar?
Well, you know what? There are some available on, again, on Producer University. So Producer University actually has, I mean, there's a lot. I could go on for a long time with it, but Producer University has a resource tab, and the resource tab has some of those presentations available, like the marketing, Medicare 101s, things like that. I'll find out a little bit more if we're going to be doing anything in the community. I would think that if you're going to do presentations, we would want to kind of sit down and make sure that you're covering, everything that's required by CMS. So, but yeah, if you are, then we can work on an arrangement for you to do a meeting.
Excellent. Okay. Any other questions out there? We'll just give it a second and give you a minute to type if you're not a fast typer. And just so everyone knows, I will have some information that I will forward out after the presentation that Angelo provided, kind of detailing some of the items he covered today. So there's some like one-pagers that you can pretty much keep as a resource to view at your leisure. So I will forward that out as well.
Yeah, and it's important that you get and do the training for the Cigna for brokers so that you can keep track of your book of business. I mean, if you don't want to do all of them, at least do the first one, the basics, and that'll show you how to look at your book of business and things like that, because I know that's important.
Okay. Well, it doesn't appear like we have any additional questions at this time, but I do want to thank everyone for participating today. We really appreciate you taking the time to learn more about Cigna. And if you do not have a contract with Cigna, please reach out to myself or Colleen Baird, and we will be more than happy to assist you with getting contracting in place. It's exciting because they do have a couple more hospital systems added to the network. So again, Cleveland Clinic is who they started with, but now they have Metro Health that is on board, Southwest General that's also on board, and fingers crossed University Hospitals is in the works, and hopefully they can get that completed and that can be part of the network as well, which would really provide some parity with Cigna in the marketplace with a lot of the other competitors by having all our hospital systems included in the network. And I think one thing, just as a quick comment, is that Cigna has been around for a lot of years. They're new to the market with the Medicare products, specifically the Medicare Advantage and the PPO, HMO and PPO, but they also have a huge presence when it comes to commercial business. So there's opportunity there where you could have people aging into Medicare coming off of a commercial group plan that had Cigna that probably want to stay with Cigna because they're familiar with the company and are used to the services and whatnot. So I think that can provide some additional opportunities for you, to market and sell the Cigna Medicare product. So just kind of my comment there. With that, any final comments or thoughts, Angelo, you'd like to share with anyone?
No, I'm just excited. Another thing I think I'd like to point out, and I think Jamie can kind of back me up on this, is if somebody needs something, I'm right on it. I mean, the good thing about having somebody with experience, and I've been very successful at what I've done, is that I understand that you guys, when you need help and you need support, you need it now. And I'm very good about that. And I think Jamie can attest to that because the people that I do work with that are with Cornerstone know that I'm right there for them whenever they need me.
Absolutely. Yes, I can definitely attest to that. So you could just pay me later. I'm just kidding. Okay, well, with that, then we can go ahead and conclude our presentation for today. And again, thanks everyone for joining. And we wish you a good rest of your day. And please stay safe and stay healthy. Thanks very much for participating. Have a great day.